Crohn's disease is an autoimmune disorder that affects the intestinal tract. Usually thought of as a grown-up disease, 20% of new cases are found in children.
The spectrum of disease is the same whether you're 5 years old, 12 years old, 15 years old, or 25 and above.
But there's a distinct aspect that sets it apart.
Differentiating factors in kids that we have to worry about is short stature, so kids who aren't growing can be part of the presentation, as well as delayed onset of puberty. So those are two sort of separate symptoms that you wouldn't really necessarily see in an adult.
Gabriella Martina was 12 when she was diagnosed. As in most cases, she started with steroids to battle the inflammation and induce remission.
I did gain water weight and my cheeks were puffy, and at the time I was in 7th grade and people weren't that nice about it.
Kids don't like to be on steroids because we see all these side effects, whether it's swelling of the face or gaining weight or sometimes acne. But just having a chronic disease and dealing with it in general can be sometimes difficult.
Growing up with Crohn's can be an uphill battle. Some children will have to work with a pediatric endocrinologist to monitor their growth and hormones.
My goal as a pediatric gastroenterologist is for them to maintain a normal quality of life. So my therapies that I design for them is with that in mind.
Gabriella has learned to go with the flow.
You just kind of have to let it roll off your back, and I really don't like that medicine at all, but it did help, and you just have to look at that.
For Lee Memorial Health System, I'm Amy Osher.